emergency medical system has been overwhelmed. They could not provide for the safe treatment of patients with either PPE, hospital beds, or ventilators. Well, and just a week ago on the 7th, and these models, you can find a lot of different models, but we just took a snapshot and we said the projections as best that we could see. You could see that a week ago on the 7th, there was a projection that at that peak, and that peak being the middle of April, that we in fact would exceed our intensive care unit beds. We were doing okay in terms of those projections with hospitalizations. And in fact, the Safer at Home order has worked. People have heeded the warning, and we have slowly seen a steady a slowing of that significantly increased curve. The best projections today, though, are very different from just a week ago. And as you can see on the bottom, that same ICU bed is projected to peak not to be until early May, and it would be within the available resources of our emergency medical, of our hospital system. So we've been watching this curve, we've been watching the models and working with our hospital system and our emergency responders to make sure, in fact, that they're properly supported with adequate equipment, but watching to see what we're facing at that peak period, which has been changing every day. And that's a direct result of people's actions and trying to prepare for that worst point. Go to the next slide. So today, what we're looking at is, this was as of yesterday, that we have 502 cases. We have had 14 deaths, but that projected peak won't occur until April the 26th. Now, we have been slowing in the amount, as you can see on the bottom right, the amount of new cases per day. But even yesterday, we see yesterday the increase was 3. Today, we saw that increase be 13 cases. That's going to change daily because we're also at a point where, people are looking at alternative means for testing, and I have that on our next slide. But you can see the steady climb. Again, just back, on March 23rd, we were very low. Inside of, less than a month, we've significantly seen that case flow, and it has not. We have not hit that peak yet. That wouldn't be until April the 23rd. But another point, where we're at today, if in fact these graphs are correct, we wouldn't be back to the point where we're at today till late May or even possibly June. And so I just put that in perspective in terms of where we're at and the time frame there will be for us to get back to the point where we're at today, going through this peak period and kind of seeing that steady decline. But again, that's a projection. We hope it's quicker. We're watching it every day, and we're using the best information available to try and make that try to make those predictions. Go to the next slide. To put that in perspective, in Florida, we've in Pinellas County, we've tested approximately 9,400 individuals. So that's 1% of our population. In Florida, they've tested more than 200,000 individuals. So that's 1 for every 140 people. So they're beginning to ramp up the testing capabilities. They're beginning to ramp up private labs that can have turnaround times a lot quicker. That was a significant deficiency up until we're seeing that beginning to get caught up. But again, we're still at that point where we've only tested approximately 1% of our population. Go to the next slide. So one of the things that you've asked, for some time is, how do we come out of this? How do we know when we can make decisions to ease up on some of the restrictions? Well, a big part of that is going to be based upon state policies. And we've seen models coming out of other states where they're looking at developing ways to reopen the economy. We know the impact this is having, especially on our small businesses and on individuals and families. So we need a comprehensive strategy. The local strategy should fit and mirror with the state strategy. And so that the governor's order goes through the end of the month. Hopefully we'll have more guidance in terms of how they intend to reopen the economy, and we can tailor our local strategies with that state and even maybe national strategy. But the indications, and we've seen this play out and how others are looking at that we would like to see what is that point where we can consider other options. We'd like to see a sustained reduction in cases for at least 14 consecutive days. Why is that? That's the incubation period. And so again, if we look at the time periods that we've discussed in previous slides, we want to see that going down. Right now it's going up. It's still going up. And so we hope that peak period is sooner. Again, we'll make some of these decisions, I hope, based upon the conditions on the ground, and we'll continue, these dialogues and provide the best information available. We also want to make sure that we have the capacity to test everyone that needs a test. And so that is something that, again, is ramping up. We think that they're going to be there and that those resources will be available. But that we also want to make sure that our hospital and our fire and EMS personnel are properly equipped to treat all patients requiring hospitalization without resorting to any type of crisis measures. Every indication that we're seeing through the projections would lead us to believe that is true, and that we are prepared. But again, each day has changed, and we want the conditions on the ground to drive that decision-making process. Next slide, please. So what are the steps before easing restrictions? First, we believe that the governor's order needs to be revoked or modified. And that's something that we hope will play out over the next 2 weeks. Our local resolution, if you recall back when we first acted, was to issue a safer at home policy. A safer at home policy asks that people and businesses implement social distancing practices. So another way of addressing that would be to ease back on these restrictions, allow people to open, but do it in a safe manner. But again, we need to see how the governor modifies his order for that to occur. Again, he defined the essential versus non-essential business. We would like to see the confirmed cases and the testing and the hospital capacity that is being met, as I said on the previous slide. While this is occurring, we'd like to develop strategies to address our pools and our public beaches. We have both condo pools, we have community pools, we have hotel pools, and each one has there's a specific need, but we need to be able to manage that. There are thousands of pools, and so in fact, we need to be able to. The sheriff needs to be able to respond to any concerns, to be able to implement safe distancing practices. I know the need. I understand that there are many condo complexes where you have a few people going out there using it for exercise. We also have pictures and real life examples of condo complexes where the pool decks were full and people were not implementing safe distancing practices. And so, unfortunately, applying a uniform manner helped us to tamp down the curve and get a handle on what was a public health crisis. The same thing goes for beaches. Beaches are a little more particular because they can attract a lot of people back to the hotels, to driving over and parking, even if we close parking areas into neighborhoods and other things. So we need to work with our municipalities regarding how, in fact, we would open public beaches. And I think that input from them and working with our law enforcement personnel to have a comprehensive strategy in anticipation of a relaxation of those orders at some point in the future would be important to have a strategy that we would feel comfortable presenting to you. So those two areas need to be refined further. We have a bit of time, we believe, at staff before we're ready for that. And so the one thing to remember is all of these indicators should be based upon the conditions on the ground, to what is actually occurring. And if in fact we ease restrictions and we see a reoccurrence of increased cases, that we need to be prepared but be able to modify our orders to where we can contain the virus and not have community spread. So that is a very brief overview of kind of where we're at, the issues that we have facing us, and how we would recommend proceeding with this, with our emergency order. Now, I would also ask, and we've had a big question regarding the essential businesses. And again, that was defined by the governor's order. I would ask our county attorney to address that in terms of the response and how we've, referred people to the governor's order and some of the inconsistencies.
Yeah, building on what the county administrator is, just presented to the group, we have been, to the extent that we've been getting inquiries, like he said, referring folks to the governor's office. In the executive order that we're traveling under now, primarily from the governor, the stay-at-home order, there is a process set forth in that order for folks to contact. The term is the state coordinating officer, and that individual has the ability to add to the list of essential businesses or services. Here at the county level, we do not. As you all know, there was a bit of a debate when the governor's order first went into effect. There was very immediately a subsequent order issued that seemed to take away the authority of counties to do anything to the contrary. My opinion is it didn't take it away. It just restricted us to the point that we could be more strict than the state's order, but not less strict. So in other words, in my opinion, we cannot deem something essential that the governor has not deemed essential. So we have been providing folks that contact us, to the extent that we can get that information out, the information on what is set forth in that order and the means by which they may seek relief with the state. And I know that there has been much contact, much discussion actually, about some of the businesses out there. And I know that you all have received a great deal of contact about some businesses in particular that would like to be deemed essential. And again, here at the county level, we don't have the authority to stray from the governor's order. One thing in particular I will mention, and I have informed each of the commissioners of this, is that we actually had our first lawsuit served on the county yesterday regarding a COVID-related matter, and that was a lawsuit filed by a local business seeking an injunction from a judge to basically allow their business to reopen. Woody's Wash Shack is the name of the business. Ironically, they never once called themselves a car wash in the lawsuit. Rather, they referred to themselves as a sanitation business. And I mention that to bring forward the fact that the sheriff has to send his deputies out there and his staff to try to enforce this order. And I don't want to speak for the sheriff, but I don't really think it's fair for him to try to give direction to each of those deputies out there to perform an analysis as to whether somebody is washing a car or sanitizing a car or, perhaps doing something else. I know that we have taken the perspective, if the business is not on the list of essential businesses, it's not essential and it needs to be closed. And again, we don't have the authority to designate something essential that is not deemed essential by the state, and they have set forth a process for doing that.
I would also add that we understand there's inconsistencies throughout different counties. We are not the only county that has taken the position we have on certain areas. However, we have also submitted a list to the governor's office asking for clarification regarding particular things within his order. And again, we have not received a response to that.
Commissioner Eggers, you had.
Yeah, thank you, Madam Chair. Yeah, that was the question I was going to ask is how are we dealing with these different questions that come in? I know we're funneling them to you all, and then in turn we're making local decisions, or are those requests first going up to the state to get their input? In the meantime, we're considering them a non-essential, but we've sent them up to the state for input. Or are we making the decisions locally? I think some of the confusion with people is that there is such differences in counties on some of these areas, not on all areas, just several of them. And so just trying to have a better understanding as to how the process works. And then at the end of it, how we may make maybe a slightly different judgment, I think would be helpful for some of these businesses to understand.
Well, the sheriff and I, as this began to unfold, we met, we talked through each one of these individual situations, and we had to make a decision. And we made that decision. And so we're trying our best to interpret the governor's order and implement it. There is plenty of room for clarification within the governor's order, as you're well aware, and as we previously spoke about in our meeting. But again, we had to make a decision. We did so. But we also left open that the governor could further clarify his order, which he did with pro wrestling, and said that that was deemed an essential business. So if he would do that, that would be fine. We're trying to implement it as we see fit in terms of how we interpret the order. And so I apologize for differences amongst counties, but we were left with implementing a very broad order, and we did the best we could with it. And I don't think we can continue to debate over and over again, whether something is deemed essential or not. We did the best we could with it, and we're implementing it as we read it.
Yeah, I think that's important to understand. I just want to frame that, because a lot of this isn't on us. Some of it is, and I just, again, we have to keep reminding folks that that there is a little room for judgment, and you all are, as you say, doing the best you can. But thank you for that somewhat clarification.
Commissioner Welch.
Thank you, Madam Chair. I've got three questions, and the first one, I just want to agree with Barry that the way this was implemented statewide does leave room for interpretation by the counties. I mean, that's kind of built into the way they roll the order out. And so I know it's just very difficult when you hear one county's allowing a service and we're not. I think that's just a product of the way the order was rolled out statewide. My first question is, when does the governor's order expire? The second question is, where are we on testing, and is there any rapid testing in Pinellas County? And I didn't know if Dr. Cho was going to be on our call or not.
Keep going.
The last question is, I know all of our hearts just sink when we talk to these businesses that are, they're saying they're a couple of weeks out and this is their life's work. And it's so tough to say, no, we can't allow you to open back up because this is the state's essential list rule. But where are we in terms of planning our, connecting these businesses with real resources? Because a lot of what we're hearing is that the resources that are supposed to be out there, the websites aren't working, they can't get through the application process, and they're not getting the help they need. So where are we in helping them connect to real resources? And then where are you, Barry, on your plan for Pinellas County's effort to help those businesses for the restart and the rebuild?
Okay, so first, the governor's order was extended until April the 30th. So that's the first piece. The second piece, in terms of the businesses, there are thousands of businesses that are impacted. You're hearing from a few, but there are a lot of small businesses and restaurants and everybody else that's in the same exact position. And remember, if you recall a few weeks ago, our Safer at Home order and where we wanted to go was to keep small business open by implementing social distancing practices. That is my preference. I know that's a sheriff's preference, and I want to be back there. We are trying to implement a governor's order, and if we have literally hundreds upon hundreds of requests that we had to make a decision on, and different angles that people are going after under this, and we certainly understand that. I'd be doing the same thing if I was trying to, keep people employed, keep my business. I do understand it, but we had to make a decision regarding the order that was given. We had to interpret and we had to implement it. In terms of assistance to business, couple things. One, and to individuals. I mean, we know the state's unemployment has had challenges. We're trying again to, connect people, but we can't put them in through that system. Through small business, our small business Development Center has links to resources and assistance for small businesses to try to link them and help them navigate the state systems that would link them up to resources. The second item on the agenda, however, is going to be discussing direct assistance to our businesses and to our families that we have been working on as a program that will be implemented by Pinellas County. And so we want to link people with the state resources, with federal resources, and we also want to try to help them directly. So it'll be a combination of both of those, but I encourage anybody that needs assistance, one, to call 211. They can link families. If you're a business, call our small business, our economic development department. It's on our website. It all talks about the assistance programs that are available, and our staff will help you to navigate those programs and connect you with those resources. We can't do that for you, but we can help you in trying to get the resources, the state or federal resources that are available.
Chair Gerard, may I say something?
Yes, please.
Commissioner Welch, you know, the CARES Act has a lot of different pots of money to it, with different rules for each pot of money. And one of the big pots of money that will be funneled through the county is this direct assistance to business. This is different than the program that went through the banks, where I'm sure you've heard people have maxed out on that, because they have maxed out on that apparently from what I've read. But these new pots of money, which are part of the CARES Act, and Pinellas County has an allocated sum on that, is to benefit businesses which have been hurt by the coronavirus and their business impacted. This federal legislation was passed so quickly, you know, it doesn't go through the usual careful process, and trying to get the rules involved with this and who qualifies and how is it going to be dispersed. And there's also a big push by the federal government to disperse this money in a real quick manner. As a matter of fact, one of the reports, which I'm sure Barry's going to be talking about, I know it's part of the agenda, is something where we have to give our initial indication tomorrow with a report saying, yes, we qualify for these funds and they will come to Pinellas County. But that's just an indicator to put us on the chart to make sure that we're qualifying for those funds. I'm sure Barry's going to talk about this more later, but there's a good amount of money there for local businesses that the county will be helpful in.
Thank you, Ken. Madam Chair, the last question was on the testing.
Mhm.
The testing, is Dr. Cho on the line?
Yes.
Yeah.
Can you hear me?
Mhm.
Yes.
Yes.
Good morning, everybody. So in terms of the testing, we do speak to the hospitals on a pretty regular basis. I think what they've done over the last few weeks have been amazing. They've been able to increase testing capabilities. I think the rapid test you're probably referring to, Commissioner, is that Abbott 15-minute test. I know, I believe Baycare has that test, and I know other hospital systems are working to develop a similar rapid test, so whether it's the Abbott test or others.
Okay, thank you.
Commissioner Long, did you have something?
Chair, I sure did. And weighing in on this discussion that's been going on between Commissioner Welch and our clerk, I am very aware that those federal dollars have been sent out. The problem is they are stuck in processing. And when you try to run that down and figure out where the glitch is, the Small Business Administration is telling people that it's in review, that they've been approved, but it's in review. Well, I don't know what that means, quite frankly, because the idea was to get the money in the hands of those people that can continue paying their employees and keeping their business open. So that's my first concern. My second concern, while Barry touched on it just ever so briefly, is I'd like to know if the rest of my colleagues are receiving phone calls and messages from our folks that have lost their job, who have now been unemployed for a month, who have tried to file for unemployment, but cannot get through the application process because you get so far into it and then the whole damn system just throws you out and makes you start all over again. Yesterday, I was on the phone for more than half the day talking to our state legislators to ask and plead with them, can they please get this system fixed? If ever there was a time when it needs to work, it needs to work. And, you know, while I certainly don't want to cast aspersions on anyone, I know that our governor inherited this terrible product, but come on, there has to be some way to provide these people some level of assistance when they can't pay their rent and they have no money to buy food. What are they supposed to do? If we think we've got a crisis right now, these people are desperate, and desperate people do desperate things. So we've got to put some kind of plan in place to help these people. And what can we do as a county government to help get the state to get off their dime?
Well, I think we're going to talk about that in the next issue. Commissioner Long, I know the Career Source has some ability to help people fill out the paper applications and get them submitted, since the website is not working very well or at all.
Thank you.
Anybody else? Yes, Commissioner Justice.
Thank you, Madam Chair. The question I had goes back to that essential business issue. I think we've all talked with a lot of local businesses that are trying to figure out the rules of the road here, and I've heard from companies that support the golf industry because golf is essential. They help support that with repair, but they're not essential. I've heard acupuncturists who think they're under health, but different rules for telehealth. I just want to be clear about the process that they call us, and then we've been sitting it upstairs, but it's not really our decision. It's the state's decision. So I guess if we're not deciding, we should be funneling that straight to whatever division in Tallahassee that is going to make the decision whether to add that specific industry to the essential list, like the governor's done with a few others. The article I read the other day said the governor said he hadn't actually got that many calls about being added to essentials yet. That's exactly what our email is flooded with, whether it's dog groomers or golf support or anything else, car washes. I just want to be clear about the process and who holds the actual authority. And what I hear this morning is that the governor and the state emergency hold that authority, but it keeps coming to us. So I just want to be clear about the process. And do we have a name and an email and a phone number to refer folks to so that they can go straight to the person that will actually be making the decision?
Commissioner Peters, did you have something?
Did you want to have someone respond to my question or?
Nah. Yeah, Mr. Burton, do you have?
Well, it is a state coordinating officer as the way it is defined. I do not have a specific number. While we're talking, I will have staff, look that up, and that way I can put that out. But I don't know who the state coordinating officer is. We contacted the governor's office directly with a list of clarification issues, which includes car washes, which includes dog groomers, and some of those others that we've said. And we've offered any type of assistance to provide better clarification on some of the issues that everybody's struggling with interpreting how to implement this order. Again, we have not received a response to our request, but we did make it.
And if I could add to what the administrator's remarks, there is another executive order that defines the state coordinating officer as essentially the director of the Department of Emergency Management at the state. We can try to track down that information. I don't know how successful anybody has been in appealing to the state with any of these issues. I think that one point of confusion that may be out at large in the public is I know that many of the requests that I have seen come in are businesses stating, but we can comply with the CDC guidelines. We can social distance, between employees, between patrons and employees, and that is simply not what the governor's order says. Your original order that was enacted here in Pinellas County prior to the state's order took what we felt were very reasonable measures and said, we are asking businesses to implement CDC guidelines. So in other words, no groups more than 10, implement social distancing. The state's order does not take that tactic. The state's order simply lists businesses that are deemed essential. So regardless of whether or not you can implement social distancing, or other CDC guidelines, if you're not on the list, you're not essential.
All right. Yes, Commissioner Peters.
So Barry, I appreciate the work that you've done, and I really appreciate the work that Dr. Cho and the sheriff have done. I brought up on Monday that I would like to see us relax on the pools, and I know you touched on it. You said that there's been an increase suddenly, and I know this morning there was a little uptick, but I'm looking at 14 days of declining and almost flattening out. And I really do believe, as I said on Monday, that citizens should be able to use their pools. I certainly can use my pool because I live in a single family resident, but the people down the street in a condominium cannot. Many of our condominiums are snowbirds. Many of them are half empty. They're not doing vacation rentals. So you may have a condo unit with 10 units, but only 4 people are living there because the other people aren't there right now. And yet those 4 individuals can't use their pool. What I've seen out in the community is that people are being safe. People are keeping their distance. They're being very responsible. And I do believe that people can be responsible by going down to a pool. And if somebody else is down there, they can wait till somebody else isn't down there. I do believe it's important to many of the people that live in our condos, particularly senior citizens, that they have the opportunity to recreate and as many options as they can. Now, if they are a high risk, then of course, as they're doing now, they would also do the same when it came to going to their pools. You've got many people that are at high risk that are going to the grocery store and they're using an elevator. We haven't closed down elevators. I understand the sheriff doesn't feel he's ready to open up the beaches at even an incremental level. I understand that. I respect that. If he feels he's not ready to enforce that, I would agree with him on that. But I think on pools, I think we kind of picked winners and losers, and single family homeowners can have a pool, and yet somebody in an apartment building or a condo building cannot be in a pool. I'd really like to hear, what the sheriff says on enforcement on that. But based on what I've seen out in the community, people are being responsible. And I think we can trust the citizens of Pinellas County to stay safe and be safe, because nobody wants to be sick. There's nobody out here that wants to get sick, right, that wants to be at risk of death. And I trust our citizens that they're going to do the right thing. And I think it's time we let them have another opportunity for recreation and use the pools that are on their private property. And so I'd like a conversation about that, please.
Yes, Commissioner, Mr. Burton.
Okay, so just a couple of clarifications, and I would like the sheriff to weigh in regarding the pools and the enforcement and what they saw, because we absolutely understand that there are differences among small condos and larger condos and things like that, but there is an enforceability. But let me just clarify one point. We have not seen a decline locally in our case numbers. You're exactly right, they're going up. We were very excited yesterday when we saw an increase of 3 or 5 or something like that. It was very small. Today it's up 13. Is that leveling off? I certainly hope so. I certainly hope that peak is not April the 26th. Originally, just a few days ago, it was April the 21st under the models. These models, can be wrong. And so we're watching that literally every day. And I hope that peak is tomorrow and we see a steady decline. But we haven't seen that decline here locally. And so I think my only caution is that we do make these decisions based upon what we actually see here locally, to where we know we're coming out of this. There's a 14-day incubation period. That's the reason we chose 14 days, is that we're seeing a decline in the cases, a decline in the numbers, and the people that have been positive, and we're seeing that decline have been through that incubation period. Those are some of the guidelines that we're seeing out of our health experts, and that's the reason we kind of picked that as a tool for us in that decision making. So, because the numbers have gone down, at the state level, but again, we just need to apply that locally as we go into this a little bit further. And I certainly hope that model's wrong, and I hope it's tomorrow. I really do. But I'd like for the sheriff to comment in regarding the enforceability and the issue on the pool.
Well, just before you go to that, Barry, you didn't put the presentation that you sent in Granicus, so I can't go back to the page I want to refer to. But if you go to the DOH website, March 30th was our highest number of new cases. And ever since March 30th, our numbers of new cases have gone down, and they seem to have put a kind of flat line that jumps a little. And I don't believe we're ever going to have no new cases. And again, what I'm talking about here, and I understand your position, and I guess you and I are disagreeing on the graphs that we're looking at, because the graph that I'm looking at, it peaked at March 30th and significantly declines on new numbers every single day. And even the new numbers from yesterday are significantly lower than the numbers were 3 days ago. So
Well, that's in the number of new cases. The total number of cases has not gone down. It has increased, and it continues to increase.
well, then that may be a sidebar, but you'll have to explain to me when we look at total cases, right? So we have total cases right now, 473. I'm not sure that, because you're going to count the case that happened March 15th. That never comes out of that case. So, you know, maybe I don't understand how you're looking at those numbers. I'm looking at total new cases. Total new cases are, you know, what I think is, you know, evidently we're looking at different numbers. And I look at the state number on their new cases, and again, they're going down statewide. So I'm not sure I understand what numbers you think we should have, because if it's going to be total cases in the county, the total cases are never going to go down. Only
yeah,
the
they
total
will.
new cases are going to go down.
Why don't we let Dr. Cho, because he's our health expert in looking at these models, and ask him to comment on that.
So with the modeling, it's tricky. I think there's a number of models out there, and we're trying to create something locally. And I just looked while we were talking here. The model that's most recently cited, the most commonly cited, the one from the University of Washington, what they call the IHME model. They just changed their peak again, because this shifts as new variables come into place. And they're now peaking us back at May 3rd in terms of the cases. To some degree, that's a function of what we're doing with the social distancing, if you think about it. So as we're flattening the curve, and you flatten that bell curve, the peak is actually shifting over. So that is something that we're monitoring, and something that we need to continue to monitor. Beyond this, we need to also look at some of the epi curves on a regional level, something that we're working with the data group on. Because it wouldn't matter as much if, for example, we were going down and Hillsborough was going up. We want the whole region as a whole to mirror the same curves. And for the most part, it looks like it. And I like to think we're plateauing, but the modeling and what the experts are saying, we still have a week or two before we actually do see the peak, both in Florida and here in the Tampa Bay area.
Sheriff, do you want to address this issue?
Sure. First, let me just go back to Commissioner Justice's question as far as getting any additional guidance from the state. You know, we've tried, and what we've been told is that you got what you got. So I don't think it's realistic that we're going to get anything else, and we are making these decisions. You know, ultimately, I guess you ask, you know, who's ultimately responsible? I guess it's me, because from an enforcement standpoint, that's where the decision has to be made, and work closely with the administrator and know that we are vetting all of these questions, and where we can, we are working with people. I've gone out myself personally to a number of locations, assessment, and made decisions. So there's a lot of diligence and due diligence going into the decision-making process. But from everything that I've been told, everything I've seen, everything I know, is that it has to be at our level here at a local level, and the state isn't going to do anything more. So just fill that in for you, is that we've tried, but that's what they've said is that they're not making any adjustments. You got what you got, work with it. So that's what we're doing. As far as the pool issues are concerned, there are almost 1,000 pools in Pinellas County. And one of the things I can tell you for sure is that any decision that's made has to be all or nothing. It is impossible. And we've seen this throughout this event, to do things on an incremental basis. It creates an enforcement nightmare. And it also creates a lot of probably reality, but certainly perception of unfairness. Is you can't say that, okay, we're just going to open the condo pools and the HOA pools, but we're not going to open the hotel pools. We're not going to open the country club pools. We're not going to open this pool or that pool. And it creates a have and have not situation. And, you know, and I also say that having people in the pools where we've seen it is that, yeah, some people use it for exercise. Sure. But also, you know, people consider exercise chugging a Budweiser and partying in the pools and those kinds of things. And it has to be an all or a nothing. And to think that you can put caveats on it or certain restrictions on it. I can tell you is that it's just like all the things that we're battling with the businesses is that the majority, the absolute majority, are trying the best they can and are complying. But there's still a lot of challenges out there, and there's a whole lot that are trying to put a round ball in a square hole. That are manipulating it, trying to twist it, trying to do these things. And I used this in a discussion the other day when we all had, and I'll say it again, is that when you decide to go down this path, you follow it through. And you don't when you take that prescription of penicillin, you don't stop halfway through the prescription. You follow it through to the end. And we're 2 weeks away now, 2 weeks tomorrow from when the governor's order expires. That's a point, I believe, for all of us. And the decision that the governor makes, whether to extend it, amend it, let it lapse, and then it would kick it back to the counties to decide. But we don't know what the governor is going to do. And trying to make decisions now, and I agree that the counts are still going up from all the data that I've seen. We are not at the peak by any of the models. And I think that as far as the pools are concerned, is that it has to be an all or nothing. You cannot say we're only going to open up these certain pools or only for this purpose or for this reason. There's no way that we can adequately implement that or enforce it.
Anybody else? Okay, we have, yes, Commissioner Peters.
So Sheriff, I respect everything that you said, and I value that, and I understand how difficult this is. And just like somebody sitting in their pool in their backyard might open up a Budweiser, I understand how that could happen in a condominium. I understand that. We've said that we want to wait until the governor's rule, and I agree with that. I'm not saying we should do anything that the governor's order doesn't say. The pools is something the county did, more restrictive. And I really would like to see the county open up the pools. Now, I'm certainly willing to make a motion to change that in our executive emergency order. I don't know that I would get a second, but I really think that people should have the right to be on their private property and use their swimming pools with smart regard, with health and safety in mind. But I certainly would entertain that. Maybe you all consider that. And if there's no second, that's fine. And I'll end the conversation.
Commissioner Welch.
I have a question, and when we're talking about this data, I think we always have to remember that it's imperfect at best. We are not testing enough to even know, how much of the virus is out there. And so it comes back to testing. We've tested 1% of our population. We really don't know. My question is, there was an article and staff sent us some information about 28 people at a Seminole facility that were had to be sent out to different facilities yesterday. Are those new cases, or was that 28 already in the reported hospitalizations that we had?
Ask Dr. Cho to comment on that.
So what the state does, and it was included for the most part in the daily update and the case counts, they do separate the cases based on the long-term care facility. As of this morning, we were up to 60 in various sites. I think I've mentioned here some of the process and how we work with the long-term care facilities. Once we have a case, we work with them, do a joint inspection with AHCA to look at any deficiencies, staffing issues, infection control practices. From there, we do a monitor and a test when other residents are symptomatic. We are in communications with them on a constant basis. And if the need arises and they need more resources, need additional assistance in terms of supplies, we do help facilitate that, and we do serve as a subject matter expert and consultation on some infection control practices.
So those 30 were already in our number of 500 plus.
Yes, they're included in the total case count, but they also separate of the 513 cases. Of those cases are either staff or resident in the long-term care facilities.
Okay, thank you, Madam Chair.
Thank you. Commissioner Long.
Thank you very much, Madam Chair. I would just like to remind everyone that we have historically always taken our actions and our votes based on the data that we have received from administration. And I would like to go on record that I think every single one of us are very sensitive to the needs of our citizens. You all remember when a while ago there was a comment made that the state knows better how to take care of our citizens than we do. But the fact of the matter is we are leaders in our community, and we are responsible for life and public health and safety in Pinellas County. And I do not intend to vote for any motion or anything that is not supported by facts and by data and by the science that Dr. Chow has been providing. Thank you.
Thank you. Commissioner Eggers?
I wanted to ask Commissioner Long if she was looking at my notes. That's kind of where I was going.
No, I wasn't.
I'm teasing, but I just.
You are supposed to be sitting right beside me, and I don't know where you are right now.
Yeah, you're not there. No, I think we have asked since the beginning to develop metrics, to develop numbers, and I think a lot of people asked us going into this, how are the numbers guiding you into this pandemic? And I would argue that probably not nearly as much as how they're going to guide us out of the pandemic. And I would suggest that probably within a couple, 3-4 weeks, it's going to be back in our laps to make other unwinding decisions, or where we start lowering the restrictions or lessening the restrictions. And we have got to have a methodology about doing it. I mean, again, there's a lot of qualitative things we're talking about. We're talking about enforcement, and we're talking about, different qualitative issues, but these numbers are so incredibly important. And I do think there's a fairness issue on the pools. I don't know where you draw the line on the pools. And I've gotten a lot of emails from people that are in the pools or part of condo associations, and they're saying, please don't open them, because there's always about 10% of the folks that just don't do what we ask them, or what the association that they're a part of asked them to do. It's just, there's an inconsistency there. And I think, there's an enforcement issue, and I think the fairness issue that was brought up. I would be interested in hearing Dr. Cho and the team as time goes on, that flattening the curve, which I think we've had some success, but how that extends. It does extend that maximum date. I guess now, as you said, it's April. Well, it's in May now. So I think that's going to be important to understand a little bit more. But I do think these numbers and looking at the region, as Dr. Cho said, is going to be so critical that I would definitely agree that we need to look at numbers. And given what we've seen today and what we've been seeing, I would like to leave pretty much things status quo as they are. Thank you.
Thank you. So yes, Commissioner Justice.
Thank you, Madam Chair. And to echo on Commissioner Eggers' comments, and just to remember that we're going to meet again on Tuesday, and we're going to be meeting weekly to extend the order. So every week we'll have an opportunity to make adjustments if we see a change in the numbers or some situation that merits that change. So I just want to make that point. Thank you.
Thank you. Mr. Burton?
Yes, in answer to Commissioner Justice's earlier question, the state coordinating officer is the Director of Emergency Management for the state of Florida. That number is 850-815-4000. That's 850-815-4000.
Yes, Commissioner Peters.
Barry, have you worked on a plan for getting things open up again, or have you not started working on that?
We have frameworks of ideas, and we kind of outlined some of those, but I think it's very important, as the sheriff discussed, how do we need to work with our municipalities and bounce some ideas off of them, especially with regard to the pools and with regard to the beaches.
So do you have I'm sorry.
Well, we have ideas. We need to further develop that, and that's the reason we put in our presentation that develop strategies and plans to address pools and beaches. We have ideas, but I think it's too early to roll those out until we have other input from
Well,
everybody involved.
Okay, well, I wasn't talking about that. I was talking about, have you got that exit strategy, that exit plan? Have we started working on it? Have we gotten serious about it? Are we still in crisis mode, or have we started a team that's going to start working on the exit plan? Because I'm very uncomfortable taking away people's rights. It's very difficult.
Absolutely. I think one of the things we talked about in the previous slide was that the first logical place to be on easing of restrictions would be back to a form of the safer at home order, to where we're opening businesses up with the caveat of implementing social distancing practices. So how that works and how we would implement that, but that's the first place to start. At what point? I think that's something we're still trying to figure out, and that is going to be, every single strategy we've seen has been part of a larger state strategy. And so we're very interested. So we have ideas and we have that in place. That would be our first step that we would recommend. However, it's got to do that, we have to see the modification of the governor's order. So that would be our fallback position, our next step. The other piece, then, we need to develop specific strategies regarding the beach and the pools.
Okay, thank you. And again, the beaches and the pools are not in the governor's strategy. And
that's correct. That's ours.
Right. Yeah. So thank you.
Mm-hmm. Thank you. Mr. Justice, did I address you before? Commissioner Seal, please.
Let me try to get her unmuted. Hold on one second. I'm unable to get Commissioner Seal unmuted right now. Oh, there she goes.
There she is.
Sorry.
I'm sorry, my mute button wouldn't work. But well, yesterday, a member of our medical community here in Pinellas County sent me a very, very good roadmap to reopening, to the national coronavirus response. And I sent it to Barry, the sheriff, and Dr. Cho. I believe that your assistants have it already, but it mimics everything that Barry has laid out today, with the cases declining for 14 days and testing for anyone who has COVID-19 symptoms. And that's probably the biggest hurdle we have right now. We don't have the testing capabilities here in Pinellas County. So I'll make sure that you all receive this roadmap. It is done at the national level. It's very comprehensive and really lays it out.
Thank you. Commissioner Akers?
You also mute yourself back. There's a lot of people that have open microphones.
Commissioner Akers?
Yeah, and the only other thing I was going to add is that you know, I think that our staff and our many of the different committees that have been formed are going to have some of these conversations, I think, that are exactly at the issue that Commissioner Peters brought up, and that is trying to figure out how we're going to unwind and get back to normal. That is certainly the next phase, and I think that kind of conversation also needs to be taking place with us. And I don't think it means that at the next meeting, when we have a discussion about this issue, that we're going to vote on anything. I guess if I had anything to say about last Monday is that, you know, I'm sorry that, you know, just a comment or two about a thing translated quickly into, we're going to take a big vote today. And I had a part to do with that. I think what we do need to be able to do, however, is to have the conversation and talk amongst ourselves what our staff's coming up with. And even if it's not a final product, Barry, I think it's going to be incumbent upon us to understand it, and in terms our residents to understand the things that we're looking at. I think the sheriff said it a couple of times this past week on different things. It's about managing the expectations, managing our expectations, managing our residents' expectations. So I want to make sure that we have some little time reserved at each of our meetings as we go forward to be able to talk about the latest and greatest things that you guys are talking about and preparing. even though it may not be ready to mobilize and make a vote on. So that's just the only comment I had. Thank you.
Good idea. Sheriff?
Commissioner, just in response to several of your comments, is that I just want to remind you that, and I believe that you all got it absolutely right, that we got it right in the safer at home order that you all put in place a week before the governor's order, when you said that businesses to operate have to be essential or they absolutely have to comply with the CDC guidelines. And that left open a lot of the businesses that we are getting the most communication from the florists, from the car washes, from the dog grooming, from the nail salons, from all of these businesses, they were left open. And in that 1 week period, if you recall, is that we posted all of those 14,000 posters. We had direct contact with all of those businesses. The business community and the consumer community stepped up. They did the right thing. And we had those teams of deputies out there across Pinellas County from 7 o'clock in the morning to 11 o'clock at night. And we did over 4,000 checks of businesses. And we were looking for violations. And we found violations in less than 1%. That's not statistically invalid. That's not anecdotal. Those are facts. Those are metrics. That's data. And I'd suggest to you what it tells us is that's one of the first things, and I'll tell you, that's one of the first things I'm going to recommend to you when you have the power to do it. When the governor doesn't extend his order anymore, whenever that is, I don't know, or he rescinds the order or he modifies it, is that we should go back to that because it worked. And that will allow these businesses to reopen and deal with those that aren't doing it right on an individual case-by-case basis. And in that 1 week, it showed that we can do that. And I think that that is something I know that the administrator and I have discussed, but that's one of the first things that I would suggest that you look at and really keep at the forefront, because you can provide some immediate relief. But again, it goes back to, you can't do any of this until the governor either lets his order expire, rescinds it, or modifies it. And until that time, that's what we're under. But the people in Pinellas County did step up. The businesses and the consumers, the patrons of these businesses, in that 1 week period, it showed that they did what we asked them to do. And I think that's a number one on the exit strategy list.
Thank you. I just want to circle back to Commissioner Peters. You had a motion before. I wanted to make sure that we didn't have a second. I don't see one. Okay. I'm sure we have quite a few citizens would like to address this.
At this time, all members of the public who wish to comment on this agenda item should virtually raise their hands by pressing *9 if you're participating via phone, or by pressing the raise hand button in the Zoom application. Madam Chair, we have, give me 1 second here. We have 17 members of the public that wish to comment on this item.
Okay, thank you. And I would ask people to, if you're in support, or to just keep your comments short. You have a limit of 3 minutes, but if you can do your comments in less than that, we'd appreciate it.
We'll take the callers in the order that they raise their hands. Our first commenter is Mr. Tom Rask. Mr. Rask, can you hear me? Hang on. Mr. Rask, try to, if you can unmute on your side.
Yeah, it took a second. Can you hear me now?
Yes, sir.
Okay. Thank you. Good morning, everybody.
For the record, I'm sorry, Mr. Rask, can you say your name, spell it, give us your address, and then we have your 3 minutes?
Okay, yeah, as long as you reset the clock. Thank you. My
Yes,
name
sir.
is Tom Rask. That's R-A-S-K is the last name, and I live in unincorporated Pinellas County. I do support the extension of the SLE, the state of local emergency, but you're talking about a lot of other things here today, and you should revisit all your resolutions and administrative orders that are dependent on that SLE, particularly Resolution 2023, which gives far too much power to the county administrator. You are letting him make decisions that you should be making. A lot has been mentioned about these models, when this is going to peak. Maybe now you can see that a model is just a model. My master's degree was on mathematical modeling, and the models are very interesting, but they are not reality. And that's going to be true also for climate change models. The county attorney said that the county cannot designate a business as essential Yet the county does exactly that. I sent you an email while you were talking to the county attorney with a copy to the commissioners showing that the county has released a list of newly designated businesses. And I've argued, if I may use that word, with the county administrator. I said, who designated these businesses? Was it your agency? Was it the state? The county administrator says that the county is not adding to the list of essential businesses, yet it's clear that the county is doing and has done exactly that. Several of you said that the citizens have been doing the right thing. You trust the citizens to do the right thing, as Ms. Peters said, but this only seems to apply to pools, but not on beaches. You need to revisit all of these things. It's also been said that people have been well behaved. But then at the same time, the statement was made by somebody that we need to manage the pools. Why? If they've been well behaved, why do you need to manage the pools? I don't have a pool, by the way. It's not an issue for me, but it's an issue for a lot of people. The social distancing rules applies regardless of whether you're a pool or not. I don't see what the problem is here. The argument that you create a have and have not situation, you already have that. Some people have pools, some people don't have pools. One option you has not been discussed is that you can tell the state they can come here and enforce their executive order. That's happening in Michigan in some counties. You see there's protests and sort of civil disobedience all over the country. The sheriff can choose to tell the governor, well, some of the aspects of this you guys are going to have to enforce. In the end, what I hear is a lot of central planning, which was a central tenet, a key tenet of communism. And trust the people to do the right thing. You said they have, so please step away from all this central planning. That is all I have to say.
Thank you.
All right, Madam Chair, our next speaker is Mr. Ken Dulac. Mr. Dulac, can you hear me? Please unmute your microphone.
I'm on. Can you hear me now?
Yes, sir.
All right. My name is Ken Dulac, D-U-L-A-C. I live in South St. Petersburg. I'm actually the president of the board of a large condo. We have, it's a high-rise building. We have 15 stories, 113 units. We have people that range in age from newborn to 99. And we have paramedics, we have nurses, we have doctors, we have everybody in this building. Closing our pool down, we actually closed our pool down a week before you did. And we did that based on our attorney's recommendation that there was liability there, that if we didn't take some action, we would have to face that liability eventually. So we actually did that. And then when you took down the pools, you know, basically county-wide, we basically, you know, went and rubbed our brows and said, okay, it looks like we did the right thing. The problem that we have is that you need to understand, even though we're a large condo, we do not have the ability to actually manage the pool. In other words, we don't have lifeguards, we don't have guards. I'm pretty sure the sheriff's not going to loan us a deputy. So if you open the pools up again, they are going to be open. And you know, we've got 150 people that are going to want to share a small pool. You know, there's almost no way that we can manage that on our own. So when you make your decision, I just want you to be aware of there's small ones, as Commissioner Peters mentioned, with 4 or 5 people, and there's big ones with, you know, 150 people trying to share one fairly small pool. And you know, your decision is going to affect us as well as the little folks. You know, so we'll have people in there swimming, and I don't know how to keep them apart, to be honest with you. I don't think the sheriff wants us out there trying to play police officers, getting in the middle of fights and arguing with people about who gets in and who doesn't. So that was my comment. I wanted just to make you aware of, you know, I'm also a small elected official, but
Thank you.
Madam Chair, I have a comment on that. Every HOA would have the authority to close down their own pools if they want to. Right now, we took their rights away from them, and if we gave it back to them, they'd still have the right to close down their pool if it's a large pool and they felt they couldn't handle it. And I just want to make that comment to that gentleman. Thank you.
Thank you.
Madam Chair, our next speaker is Tammy Vasquez. Ms. Vasquez, can you hear me okay? You have to unmute on your side.
Got it. I can hear you.
Thank you. Please state your name, spell it, and give us your address, please.
Yes, my name is Tammy Vasquez, Vasquez, and I reside in Treasure Island. Did you need my full address or just that?
No, that's fine. Thank you.
All right. Good morning, Commissioners, Sheriff Galtieri, Administrator Burton, and everyone else joining this morning. First, I want to thank you guys for working so hard to keep all the citizens in Pinellas County safe. This is so unprecedented, and we know you guys are all working so hard, and we appreciate that. I'm speaking today on pet grooming. My husband and myself own Bark Life. We have 2 locations here in Pinellas County. I'm speaking today to state the reasons we believe pet grooming is indeed already deemed essential in the governor's order and why. Not only do we, but multiple other counties and in the state believe the same. And a few of the counties that have already deemed grooming essential are Hillsborough, Polk, Leon, Brevard, Broward, Charlotte, and many counties I don't have time to mention. I'm sure you've read hundreds of, if not thousands of emails as to the health of the pets, in which we agree. However, I'm here with proof as to why we and other county officials and sheriffs statewide believe we are already legally deemed essential in the governor's order, therefore by law. For the record, in our industry, pet stores, pet sitting, pet boarding, and pet daycare have already been deemed essential by the state and local governments, including Pinellas County. But pet grooming is the only thing left out in Pinellas County, yet it is needed to perform 2 of our 4 essential services. Plus, there is no difference in the way grooming clients' pets are received and handled than is when they come for boarding or daycare. I sent all of you an email yesterday with not only the governor's order, where under essential activities, paragraph 3, where it states pet care, I also included the document from the Florida Homeland Security via the governor that was sent out to all local governments to help define the original order. Under infrastructure and support services, paragraph 2, service providers who provide services that are necessary to maintain the safety and sanitation of essential operations in residents and businesses. Our interpretation is daycare and boarding facilities must include the bathing of pets when they come in to kill fleas and ticks, plus for the sanitary cleanliness of the facility. Nails must also be trimmed as to not injure themselves or the staff. At this time, we can do none of this under the county's ban on grooming. Under essential shelter facilities and services, paragraph 3, workers in animal shelters, our interpretation. Animals come into shelters infested with fleas and ticks and extremely matted and must be shaved down and bathed by professional groomers. Plus, the pets in the shelter must be bathed and groomed regularly to maintain a sanitary environment. At this time, none of this can be done under the county's ban on grooming. Paragraph 7, workers performing services in support of the elderly and disabled population. Our interpretation, service dogs must be bathed and groomed weekly or bi-weekly to maintain a sanitary animal. These dogs go into grocery stores, doctor's offices, and more. It is imperative that these animals are kept groomed, and due to the owner's disabilities, they cannot care for the animals themselves. I'm sure you can see why we believe we are within our legal rights to be deemed essential. I'm asking that you
Madam Chair, I'm sorry, time has expired, just as an FYI.
I just almost done, if you don't mind. I'm just asking that you vote immediately to reopen pet grooming so that we and others can perform all of our essential services. Thank you guys so much for your time and consideration.
Thank you.
Madam Chair, our next speaker is Mr. Neil Volk. Mr. Volk, go ahead and unmute.
Can you hear me?
Yes, sir.
Good morning, ladies and gentlemen. Madam Chair, I may request probably a little extra time because I represent the Express Car Wash Coalition, which consists of 5 express car washes in 13 locations. I know
I'm sorry, you have 3 minutes.
Okay. We have over 30,000 members and 60,000 customers. I've sent you numerous emails in regards to why Car washes are essential. We've had these conversations back and forth. Janet, David, all of us have talked about it. I've talked to the sheriff and Barry as well. But an average vehicle has about 283 different types of bacteria in every square centimeter, according to the study by the Austin University in Birmingham. Express car washes can disinfect 500 to 800 cars a day at each location. This helps eliminate the COVID-19 and reduces allergens, as well as provide care and maintenance to the vehicles. The COVID-19 virus is reported to live on surfaces for several days. Express Car Wash serves members, which include essential workers, such as for hire vehicles, including cabs, Ubers, being used for citizens to conduct essential functions like going to the grocery store, pharmacy, and healthcare appointed, as well as essential jobs. Additionally, the facilities serve thousands of medical and law enforcement vehicles currently being used as essential workers perform duties and travel essential jobs. According to the governor's order, we understand that a retail business operation and organization not included in the category of essential business and essential activities as defined in the governor's order, as it may be amended or submitted, must close. And Bob and I have talked about that. But essential services are to be included those business activity designated by the executive order, and its attachment is consistent with the list propounded by the Miami-Dade County multiple orders. The EO 2089, a facility deemed non-essential pursuant to the guideline of state of Miami-Dade pursuant to it March 19 emergency order. According to Miami-Dade, which the governor has referred to, ordinance page 25, gas stations, auto supply, auto repair, and related facilities are essential. Car washes fall under the North American Industry Classification 81190, automotive repair and maintenance. Thus, this is included in essential governor's order. Car washes in Tallahassee are open. Car washes in Miami-Dade are open. We are respectfully asking the Pinellas County Board to consider express car washes as essential as the governor order and the board's directions and other related automotive facilities.
Mr. Walk, your time has expired.
Okay, can I finish just one thing? We spoke to the Emergency Operations Center and they said it is up to you. Thank you for
Exactly. Thank you.
Madam Chair, our next speaker is Jonathan Luce. Mr. Luce, please unmute yourself. Go ahead and state your name and spell it. Give us your address for the record, please.
First name's Jonathan, last name is Los, and I'm in Madeira Beach. I want to first thank you for considering, even though it doesn't look it's going to happen today, opening the beaches and return access to the private pools at a time where many locales, government mayors seem to have lost their minds by restricting access to outdoor space. I commend you for at least thinking about moving in the right direction. I just want to remind that increasing access to outdoor space is not lifting social distancing restrictions. You guys are already doing a good job at this. People have access to most parks and trails. They have seemed to be complying with the social distancing aspect, and people are left by biking and walking on sidewalks, 3 foot wide, 4 foot wide trails. People even have the ability to boat, although it's still unclear how it's justified to have 10 people contained on a deck of a boat, but not a deck of a private pool. Just again, the key point here with the data that Mr. Burton had presented, that social distancing, not the shelter in place, is the effective strategy. We want to remind that social distancing and lockdown are not mutually exclusive. Lockdowns and closures are just forced compliance of the social distancing. And there's emerging evidence now that looks at that the data that Mr. Burton had presented, although a great presentation, is not unique. And Commissioner Peters, you're correct. You can't look at the total cases. They'll never drop. You have to look at the new daily active cases. Those are the metrics that are looking at whether we peaked or what's happening to the curve. This pattern that's emerging is that there are many places that have not had stay-at-home orders or shelter in place, and they have the similar pattern or a display of information. The one thing that has been unique amongst all these locales has been the CDC guidelines for social distancing. There's just really no difference in the pattern of infection. The flattening of the curve was meant to be the initial mitigation strategy, but it's not the exit strategy that's going to be successful for this. You can't expect it to have 0 cases or no cases. This is going to play its way out, and it's going to follow, like most pandemics, this kind of bell curve. That was only really meant to prevent saturation of our healthcare system. And with the numbers you were showing there, our first case in Pinellas County was on, I think, March 11th. And we've had about 500 cases to date and only 87 hospitalizations. And, 3,300 staff beds, 285 ICU beds. With the rate at which we're going, we peaked on April 1st. That was what the peak was. And we were doubling every 2 or 3 days. That doubling was the fear that we were on this crazy spike. And where we're at today at 500 beds, we doubled from April 2nd, April 3rd, from 239, 318 cases. It took 12 days to double. That fear of doubling is not there. So you're expecting another doubling for this peak to happen. It's going to be maybe 4 months out. So I know Dr. Chol brought up the IHME model, but that has been wrong almost every account. The modeling is inconsistent at best. I think the sheriff department has good leadership and is more than capable to manage these the pool aspects. I think Commissioner Peters is correct.
Hello, your time has expired.
Sure, I know you guys got a lot of point here, but I think returning power to people and looking at real data, not the total cases. You got to be smart on what data you're looking at. But thank you.
Thank you.
Madam Chair, our next speaker is Cheryl Murray Powell. If you'd go ahead and unmute yourself, state your name, spell your name, and give us the address for the record, please.
Yes, hi. My name is Cheryl Murray Powell. I'm an agricultural attorney. My name is spelled SCHERLMURRAYPOWELL. I represent Sunflora Inc., also known in the community as Your CBD Store. We have 600 stores across the country, 80 in the state of Florida. And the reason why I am appealing to the commission is because we are designated as food. By statute, hemp extract is designated as food. There was guidance from the governor's office as far as what is essential, what is not essential. He pointed to Homeland Security's guidance. And it's very clear that food is considered essential. Each of our store locations have received a food certificate from the Florida Department of Agriculture and Consumer Services. I am also the former Director of Federal Affairs for the Florida Department of Agriculture and Consumer Services. I think it is an error that you would consider a store that has a food permit issued by the state of Florida, where by statute, hemp extract is considered to be a food. It is an error for law enforcement to go into those stores and order them to close. In consideration of consumer safety and our employee safety, we've already taken due diligence of instructing our owners to do only curbside service. But we recently had officers in store ordering our stores to close down when our products are considered to be food and therefore essential. Even if Attorney White's assertion is correct as far as the county being able to be more strict than the state, it doesn't mean that the county can declassify a food item from being food. So I am appealing to you to make sure that we don't have this disruption of the service that we provide to our consumers, getting them the nutrition that they've come to rely on by having law enforcement go to our stores, ordering them to be closed in violation of state law, in violation of the guidance from Homeland Security, and in violation of the guidance that is present on the Florida Department of Agriculture and Consumer Services. Thank you so much.
Thank you. Sheriff Galtieri.
For everybody's benefit, that attorney sent a letter yesterday. We just received it yesterday. It's sitting on my desk, and when we get down here this morning, we'll address it. So that's an example of we're going to look at them on an individual basis where there is room for evaluation, and I'll do that this morning. So, she just said it yesterday, and she just called in now, but we will evaluate that one and make an individual determination on it, because on the surface there do appear to be some validity to her position, but we'll look at that one.
Thank you. Do we have another speaker?
Oh,
I'm sorry. Commissioner Eggers?
I didn't hear her in the very beginning, and I felt terrible. What was the industry that she was talking about? I'm sorry, I didn't hear that.
It's CBD hemp, okay, which would be the 0.03% or lower. And it's food products, which is different from smokables, different from vape, different from those stores that are selling the vaping and smoking in the tobacco shops. And if it is in fact food, then that's something we're going to evaluate. So it's really CBD based food is what her concern is.
Thank you.
Madam Chair, our next speaker is Ms. Sharon Calvert. Ms. Calvert, if you would go ahead and unmute yourself, give us your name, spell your name, address, and you'll have 3 minutes. Thank you.
This is Sharon Calvert, SharonCalvert, and I'm in Tierra Verde. I'd like to put some context on the numbers, and I will tell you, I'm very, very thankful that in Florida, as the third largest state in the country, I think we have done very well. And the Tampa Bay area in particular. So when you look at the overall number of cases in Pinellas County, the 520 cases of the 22,897 reported by the FDOH tracking website, it's in Pinellas County, it's 2.3% of overall Florida cases. On the hospitalizations, Pinellas County has had 104, which is 3.1% of the 3,305. And unfortunately, on the deaths, there's been 14 in Pinellas, which is 2.2% of the 633. So again, then the actual data in Pinellas County is showing that the vast majority of the residents here are thankfully abiding by the emergency orders and the social distancing. And that being said, I understand there's models, but and we have to be looking at the models as a forward projection. However, as Mr. Burton stated previously, the conditions on the ground and the actual data changes those models. And at some point in time, you have to look at both of them on the policy making side. I appreciate Commissioner Peters in her attempt to try to open up some of the pools. I do believe that there are studies that have shown that being outside in the sunshine and some fresh air is very good. We need our vitamin D. It's an antioxidant and it increases our immunity, and it's good for both our mental and our physical health. So I look forward to seeing the progress on the exit strategy. I wish that you would reconsider the pool issue, and I will say that I walk the Bayway almost every day to get outside and get my sunshine. And I am seeing the sheriff's deputies. I mean, they're already patrolling what I see as the empty pools. And I do believe that, again, the homeowners association of those condos, and my condo is only 16 units, and there's never 10 people in the pool. And I know that we've gone over this issue, but I'm on the canal and I'm watching boats go by much smaller than my pool. And it's probably harder for them to social distance. Not that I want you to close down boating, because I have a boat too. But again, I appreciate the effort that you're taking. I know it is something we haven't seen in our lifetime, but we must have an exit strategy, and we must remember, again, as the previous speaker said, the intent of the shutdown and these orders was to flatten the curve so that our medical resources and our
Ms.
medical
Calvert,
personnel
your time is
are not
expired.
overrun. Thank you.
Thank you.
Thank you.
Madam Chair, our next speaker is Rob Schuler. Mr. Schuler, if you'll go ahead and unmute yourself, give us your name, your last name, address, and you'll have 3 minutes. Thank you. Mr. Schuler?
Can you hear me?
Yes, sir.
My name is Rob Schuler. I live on Beach Drive. I've watched the entirety of the session this morning, and it's confusing and a bit frustrating. On one hand, it seems to be that everyone is saying we have to adhere to the governor's executive order, and we have little or no choice. On the other hand, the governor's executive order specifically allows swimming. So how does one swim if one can't access a pool or a beach? The governor, the county does appear to have the authority to open up the pools. And there are a number of people that rely on these for their exercise. I know one person that is on our condo building that is an amputee, and if he gains more than 5 pounds, he cannot use his prosthesis. His only form of exercise is the swimming pool. As to the city or county attorney saying that you've already received a lawsuit, what's going to happen when you start getting ADA lawsuits because there's no reasonable accommodation? Reasonable accommodation would suggest that you can open the pools as other counties have. Dr. Fauci, on the day that the pools were closed, stated pools were not unsafe, that the disease is not transmitted here. And so you're taking the pools like ours. We have over 10,000 square feet on our pool deck, and we were told it was closed. The sheriff's office informed our building that we were not allowed to access our grill because it is close to the pool and on the same pool deck. So there are some arbitrary decisions being made. And it seems that if the county wants to allow folks to enjoy their pools and enjoy the benefits of it, that they have the authority to do so and not state that they can't do so because of the governor's executive order. I support Commissioner Peters' efforts to make this, bring up this issue, and certainly would hope that you would understand that pools are a much better place than if those 10 people were to go crowd onto a public bus, not knowing who was on there or who's touched it beforehand, which is permissible.
Thank you.
Okay, Madam Chair, our next speaker is someone calling on the phone line, last 4 digits 5301. If you'll give us your name, spell your name, give us your address, and you'll have 3 minutes. Thank you.
Yes, this is Michael Shelley. I live in North Reddington Beach, and I'd like to speak to the point of the blanket closure of the HOA pools. Commissioner Peters started to address on it a little bit, and I'm sorry, my last name is spelled S-H-E-L-L-E-Y. Commissioner Peters started to address the differences in the pool sizes, and no one's directly addressed the Florida Statute 33, Chapter 514.0015, Paragraph 2A, specifically designates private versus public HOA pools, where the line is 32 units. So I would like to hear your board address the difference between the private and the public HOA pools and how you have the authority to override that Florida statute dictating the small HOAs, such as, like I said, under 32 units, and not allowing them to have use their pools. I actually did follow the guidelines to submit the comments and participate in today's meeting, but for some reason, my email and attachments weren't in the agenda that outlined all this. And then, like the previous caller stated, I'd like to reiterate that the CDC specifically says that this is not spread through swimming pools. And to the sheriff's comment about penicillin, you have to finish the prescription to be able to get through it. Well, also, if you don't have an ailment and you take penicillin and you continue to take it, it creates a larger problem. And I think that's where we're at today. So if you could please discuss the private versus public HOA pools with the 32 units drawing the line. And again, I support Commissioner Peters and her motion to open HOA pools. At a minimum, the private pools under 32 units, just like single family homes where the neighbor comes over, there's no difference. Thank you, that's all.
Thank you.
Thank you, Mr. Shelley. Madam Chair, our next speaker is Danielle Ciliento. Ms. Ciliento, if you wouldn't mind unmuting yourself, giving us your name, spelling your name, giving us your address, and then you'll have 3 minutes. Thank you.
Good morning. Hi, my name is Danielle Ciliento. That's D-A-N-I-E-L-L-E-C-I-L-I-E-N-T-O. I live in Bel Air, Florida. I'm actually a Clearwater native, born and raised here, and I've lived here all my life. And I was calling in today. I'm a little disappointed that the vote for the beach didn't go through as I thought it would. But anyway, I'm asking you to please consider reopening the beaches. I'm a mother of 3 small children, all under the age of 10. I'm trying diligently to homeschool them and make this as painless as possible for my children. So after hours and hours of screen time and workbooks, my children and I need to get outside. And in my small town of Bel Air, they have started posting threatening signs in every piece of green space. I even had someone fly a drone on my children for riding bikes in the local park square. The playgrounds are closed, the rec center is closed. Excuse me just a second. A month ago, when this began, I watched as everything began to close. But the one thing I couldn't believe was ever possible to ever close was the beach. I figured that no matter what, we would at least have that to get out and enjoy during this time of hardship. Our county is a peninsula surrounded by 3 sides by miles and miles of coastline. I couldn't believe that that would actually be closed. And if I wasn't panicked before, well, then I definitely was now. I don't think panic and pandemonium are good in any community or circumstance. And I really feel sad that I'm living in a world right now where the only options for are right now feels like to tell my kids to hide under the bed, or maybe we can go to Publix. The governor's order allows for recreation, but where? Sunshine and salt water, I think, are essential in my life, and I believe for many members of our community. I'm hearing that the suicide hotline is increasing, child protective services are having trouble getting to everyone, opioid and substance abuse is on the rise, domestic abuse victims are being made to stay inside with their abusers. Children have lost their structure of school. Many are hungry and needing food. I think that the new unemployment numbers are astronomical. Our community needs to be able to get outside and get fresh air. Our children need to be able to get outside. We live here because of the beaches. I understand you may not be able to just flip the light switch on regarding the beach, but if we could just think of it as like a 3-way bulb, start with recreation, give us an outlet, give us hope. A walk on the beach, sun, salt water, salt air. Just give us the opportunity to walk on the beach. If I can take my kids on a beach walk, collect seashells and be out in nature, I know that my family will be better for it. And I believe many other families will be as well. So I'm just asking today, it doesn't sound like it's going for a vote, but please consider all of the families out there that we're trying our best to get by, but we need places to go. And
Ms. Ciliento, your time is up.
okay, thank you so much.
Thank you. Madam Chair, our next speaker is Megan Chapman. Ms. Chapman, if you would go ahead and unmute yourself, give us your name, spell your name, give us your address, and then you'll have 3 minutes. Thank you.
Hi, yeah, this is actually Matt Chapman, M-A-T-T. No problem. It's my wife's computer. C-H-A in Paul, M-A-N. We're in Clearwater, Florida. So just want to echo what's been obviously a popular theme here, that I think closing private community pools is a massive overreach. As has been explained, if certain communities decide they can't do that in what they feel is a healthy manner, they obviously can make those decisions on their own. I understand, as the Vice Chairman said, that there are going to be people who express that they don't want people using pools. As I understand it, giving people the freedom to use a pool does not compel them to do so. So people who don't want pools open can certainly choose not to use a pool, rather than make decisions for the rest of us. Again, also regarding the models, I'm a little concerned, as some people have already expressed, that we continue to talk so much about models rather than the actual numbers. The efficacy of the models have been putrid. We're now providing basically intellectual cover for how horrible they've been the entire time by saying, the narrative at first was, hey, you idiots, you're not staying home. We've got these models, we've got to flatten the curve. The models, most of them that I've seen, take into account social distancing measures. Now we're providing intellectual cover by saying, great job, guys, you guys stayed home. Well, guess what? The models that you used were wrong using the social distancing measures, and they continue to be wrong. So continuing to talk about when we can go back to our normal life based on models that have been wrong since day one, using all the things that we said we were going to do, staying at home and all that. I was happy to hear some of the numbers that the other lady presented and to give perspectives. Because I did see, I think yesterday I saw from March the last couple of years that we're talking about basically, what would be 2% of deaths across America. And I think that the numbers she gave pretty much correlated to that here locally as well. So I think we needed to a real, adult conversation is how long do we continue doing this? This 2% of what on the average, the average year deaths, does that, justify some of the actions that we're doing? At some point, there needs to be conversations with real numbers, with real perspectives, and applying, again, we've had 14 deaths here in Pinellas County. What in a mean, year rolling over 5-10 years, how many deaths occur from influenza, from pneumonia? Can we get some numbers that provide some perspective? If you put a ticker on every death for every cause of every or every person who's diagnosed with an illness, you'd have to put Prozac in the water. So I think people have their perspective skewed because we keep this rolling total. And again, someone made the point as well that we're using the numbers. We're talking about total cases, people who are tested and have it.
Mr. Chapman, your time has expired.
Thank you.
Madam Chair, our next speaker is Cameron Kelly. If you could go ahead and unmute yourself, state your name, spell your name, give us your address, and you'll have 3 minutes. Thank you.
Good morning, ladies and gentlemen. My name is Cameron Kelly. I live in Palm Harbor, and I run the Flower-Rama in Clearwater at 2001 Drew Street. I respect everybody's time and everything y'all have been saying here. My questions are really just kind of unique in that Mother's Day is coming up. I know we're not essential. My question is more about planning for the holiday, because if we're going by the governor's order that would expire on the 30th, I need to bring in product to my store no later than the 30th. And I need staff to be able to process that. So I'm just looking for clarification on, am I allowed, based on the rules and regulations right now, to have staff in the store prepping for the holiday if we are in fact not open for business? That's my first question. Am I allowed to do that, just doing the prep work in preparation for the holiday? That's question one. Question two is, based on the original order from the governor, it said businesses and organizations are encouraged to continue to make deliveries and curbside pickup. If the governor's order would be extended beyond the 30th, because we have been closed, would we then be allowed, if it is extended, to make deliveries? Are we allowed to do that now? What is the actual language of that order mean? We are closed for business, but if we are closed and we have people making floral arrangements, are we allowed to deliver those arrangements if we are closed to the public? I'm just looking for clarification on that. And just trying to plan for this holiday, if we are going to be allowed to be open, which Mother's Day is May 10th, it does take us about a week and a half to amp up for that. We have to order a refrigerated truck onto the property and again, receive our product on no later than the 30th. My last question would be, I heard Mr. Burton, I think, put out the phone number 850-815-4000, but I didn't catch what that phone number was. And I was wondering if that was the phone number for the state coordinating officer that we were talking about earlier. I wrote it down, but I didn't catch what it was for. So just from a standpoint of enforcement also for the sheriff, if I have employees in the store amping up for the holiday, but we're closed for business, is that allowed? Those are basically my questions. I know it's so gray and so hard to answer, and I'm just looking for guidance.
Thank you.
Thank you. Sheriff?
Yeah, if Mr. Zumwalt or somebody can get her phone number and then send it to me, I'll call her and talk to her.
Sure, I can do that.
And that was the state coordinating office number.
Madam Chair, our next speaker is Frank Orbello. Mr. Orbello, if you'll go ahead and unmute yourself, Give us your name, spell your name, give us your address, and then you'll have 3 minutes. Thank you.
Good morning. This is Frank Orobello, Orobello. Neilman, St. Pete is where I reside. I'm just going to touch on some points that Neil brought up with the Car Wash Coalition. As all of you talked about, Sheriff, Mr. Welch talked about the stresses on the police officers, the stresses on the economy. We do own a car wash. We're not deemed essential because of one word, maintenance. Hillsborough County and Pinellas County removed the word maintenance from the governor's distinction. The governor said auto repair or maintenance. You guys just kept auto repair. We are able to follow all CDC guidelines. We may not be essential, but we are essential to the essential workers. Grubhub, Uber, people who drive around the elderly, the police officers, they have an opportunity to clean the inside and outside of their cars. If you live in an apartment building or a condo facility, you don't have that ability anymore. You're not able to create a safe space for the people you are driving around or the items you are bringing to other people. If we were allowed to stay open as a car wash industry, there's 6 of us or 7 companies right now that are all family owned that each contribute monthly to the revenue that the county can take in, and we can safely provide a service to our customers. We are easily able to stay 6 feet apart. All our employees have masks and gloves, and we have cleaning supplies. So to argue over a very small word of maintenance, if we are able to stay open, we won't put that stress on the economy. I won't be applying for PPP program. I'll have my employees have able to not have to go onto unemployment. 5.2 million people last week applied for unemployment. 25 million people have applied thus far. $349 billion was allocated for the PPP program, yet $329 billion has already been used. So they're going to run out of money. So now you're telling a company that can follow the guidelines has to close and apply for these things when we wouldn't have to. So the officer or the officers could come around and say, hey, Frank, or hey, Neil, or hey, any other company, you're not following CDC guidelines. You have to close. That's where these resources need to be kept. Same thing with the pools. If people are not able to follow the CDC guidelines, that's when it should be closed down. Not this blanket statement where each individual county has the ability to interpret the law.
Mr. Orobello, your time has expired.
I have one question for Sheriff. What law are we breaking if we are adhering to all CDC guidelines?
We want the next one, Madam Chair.
Yes, please.
Okay, the next speaker is Brian Sykes. Mr. Sykes, if you'll go ahead and unmute yourself, give us your name, last name, address, and then you'll have 3 minutes. Thank you. Sykes, if you'll go ahead and unmute. And if you could turn down your TV in the background, that would also be helpful. Thank you. Last name, address, and then you'll have 3 minutes. And if you could turn down your TV in the background, that would also be helpful. Mr. Sykes?
Yes, my name is Brian Sykes, S-Y-K-E-S, and I'm in St. Petersburg, Florida. I first would like to thank all the commissioners for the work they're doing to keep us safe and all the hard work everyone's doing to try to support our county in a very difficult time. I run in absolutely beautiful flowers. We have almost 40 people that depend on our organization for employment. What the prior speaker said in regards to if we were open and operating, we wouldn't have to apply for grants or have those people be unemployed. But more importantly is the fact that flowers in the vast part of the state and in the vast part of the United States are determined to be essential businesses. In Miami-Dade, all flower shops are open and delivering. In Hillsborough County, all flower shops are open and delivering. In Manatee County, all flower shops are open and delivering. Flower shops are under the Food and Agriculture part of the governor's order, support of retail services for online retail. Flower shops have not been open for several weeks for public to walk in and buy flowers. They've only been delivering e-commerce orders that were enacted by either an order online or by a telephone order, which is another part of the governor's order. Finally, we're a key part of the delivery services of people's needs. We deliver food in the form of gift baskets, gourmet baskets, fruit baskets. The other point that really needs to be honed in is that flower shops are an essential business that's a retail operation that is online only right now. And it supports, more importantly, the very sad occurrence of people passing away. And when people pass away, they want to have flowers at their funeral. Currently, if there's a funeral in Pinellas County, those flowers are either going to come from Hillsborough County or Manatee County, and the flower shops in Pinellas County will not be serviced. I understand that there's confusion. Flower shops are very easy to support the COVID-19 CDC guidelines and regulations. Drivers are very safe and do touchless deliveries. Shops have all implemented more than 7 feet rule. We can easily and safely do this. I know several.
Your time has expired, sir.
From FTD.
Thank you.
Madam Chair, there are 5 remaining speakers with their hands raised. You want to continue?
Yes, please.
Okay. Our next speaker is James. Did not provide a last name. James, if you go ahead and unmute yourself, give us your name, first and last, spell it, give us your address, and then you'll have 3 minutes, sir.
Yes, thank you. My name is James Keene. I'm calling from St. Petersburg, Florida. I'd like to thank all of you for your leadership in keeping us safe, residents of Pinellas County, safe from a global health crisis. It's a global pandemic. And I'm really struck by the comments of folks wanting exceptions and wanting to move things forward quickly because we've got to get back to it. Well, actually, in my opinion, we don't need to just get back to it. We need to be mindful of the health of our residents, and the number of cases that we have today is because we've been socially distancing. So why would we then now decide is the time to start removing some of those restrictions that have been successful? Because if condos want to open their pool, go ahead, let them open it. And everybody just sign a waiver that when you need a vent, you don't get one. And anyone who wants to play, you know, these ridiculous games, then all right, well, maybe you can do that. But we have this form for you to sign that you decided that it was more important to wash cars for essential employees and to deliver flowers. I'd love to send flowers, but I mean, there are people who don't have food. There are people that, you know, like, come on. You know, I think you've been doing a great job of walking the line of our poor leadership from the governor and within the county. You've really worked hard to keep us safe. So I would encourage you to stay strong in keeping us safe, commissioners. And I am for keeping the restrictions as is. It's a difficult time. Nobody said it would be easy. The alternative is death, more death in Pinellas County. Thank you for your common sense.
Thank you, sir.
Thank you.
Madam Chair, our next speaker is Marilyn Thurman. Ms. Turman, if you could go ahead and unmute yourself, give us your first and last name, spell your name, give us your address, and you'll have 3 minutes. Thank you.
Absolutely. It's Marilyn Turman. It's Marilyn, Turman, Turman, from Clearwater, Florida. Can you hear me?
Yes, ma'am. Go ahead.
Okay, I want to make sure I was unmuted there. Okay, good deal. Well, thank you again. I appreciate, very appreciative of all you all have done. This is not easy for any of us. I'm hearing people talking about, you know, the beaches and the pools. I understand we need recreation. People are literally just, we're in a very uncomfortable place right now. None of us ordered this to happen, but we're in it. And we have to find a way to get through this and keep people safe. The first concern that I have is in reference to testing. You know, I was listening to the first portion of the meeting where we had the presentation with the curve and the numbers of cases that we have. But if we've only tested a small fraction of the population, how do we really know? I think that's the main thing, is we need to know how many people are actually infected. People who are asymptomatic can still be walking around, you know, exposing people. We don't know. I could have it today and not know it, though I feel well. And so I think that's one of the biggest things that we need to do, is we need to talk about the testing. We need to make sure that the people in our communities or in our county, that we know where the testing is, and we need to make it available for all people. And then also too, if we were, Sheriff Gualtieri talked about as we transition back, and even before the governor's order, that people were, they were doing a pretty good job of practicing social distancing. I know that at my church, we've been doing feeding for the people in the community, and we've got a process in place where we're practicing the 6 feet as we provide food. And I'll tell you, we served over 200 meals. So there's a way to do it, but there's an industry that I know right now is really suffering, and that is the beauty and the beauticians and the barbers. Now, I'm not one, but what I can tell you about them is, as I look at the photos of everybody on this video, you all look great. Your hair looks great. Your present, okay, yes, for those of you who have it, thank you. But the point is, you know, you are requiring people. I mean, we don't want our judges and our deputies and our, you know, our folk coming into their places of business not looking kept up. But here's what I want to say real quick, because I know my time's running out. We have put together a video that will demonstrate on behalf of that industry how they can actually implement processes in serving people using the guidelines that have been put in place. And I've talked to a number of them, and I would like to at least submit it. And if there is an opportunity, I just want it to be considered, because when I think about liquor stores being an essential business, now I understand a little, you know.
Ms. Turman, your time has expired.
Okay, all right. Well, thank you anyway. I will send it over. Thank you for all you do. Thank you.
Thank you.
Okay, Madam Speaker, our next speaker does not have his name listed or her name listed. If you could go ahead and unmute yourself, give us your first, last name, spelling, and then your address, and you'll have 3 minutes. Thank you.
Good morning. My name is Dan Berlin, and I'm at 6279 Sun Boulevard, St. Petersburg, Florida. And listening to this, and appreciate everybody's time and the availability to have input into this. Pulling up the governor's order on page 4, section 3, it specifies participating in recreational activities, and it states in there that an essential activity is swimming. Now, I've heard a few of the members, and I don't remember exactly who they were, saying that you can't liberalize the governor's rules, but you can be more restrictive. So it appears that you've gone in the direction of being more restrictive because you've eliminated swimming. So then anyways, I pulled up the resolution that the county passed, Resolution 2020. And on page 2, section 8, it specifically lists as place of public assembly are ordered to close. And in this order, on that section, in that paragraph, it says publicly accessible pools. And it does not say private pools. And HOAs, depending on the size, are private pools. There's no guidelines as far as the interpretation of what publicly accessible is, unless you go to the fire code for the state. And in the fire code, section 101-3.31882, it describes publicly accessible as any facility, indoor or outdoor, constructed for the use of 50 or more people. So my point is, if you're following your resolution, you're following the state law, these HOA pools do not fall under publicly accessible. And furthermore, as far as a health benefit, On March 28, 2020, the Center for Disease put out a question and answer, and with regards to the spreadability of COVID-19 through pools and hot tubs, there is no evidence that it can be spread through pools or hot tubs. In fact, it states that it kills the virus. So you're actually taking something away from the residents of Pinellas County by not letting them swim in private pools. And the last question I got is notices that are being put up by the sheriff and by the commissioner, they've changed the wording and they added the word private to your resolution. And I don't see where that was voted on. And so I'm just kind of confused. It doesn't appear that you're following the resolution that you passed. And thank you for your time. I appreciate it. And everybody stay healthy.
Thank you.
Sorry, unmute myself. Madam Chair, our next speaker is Mary Riggin. Ms. Riggin, if you could go ahead and unmute yourself, give us your spelling of your name, your address, and you'll have 3 minutes. Thank you.
Hi, thank you so much. Can you hear me?
Yes.
Pretty well.
Okay, thank you. Thank you. Mary Riggin, R-I-G-G-I-N. I'm in Safety Harbor, 3339 Briarwood Circle. I'm a licensed acupuncturist, have been since 1996. And I just wanted to clarify with this commission board that the licensed practice of acupuncture is in fact a form of primary health care as defined by Florida statute 456 and 457. And I just wanted to make that comment to clarify the misinformation that was stated earlier in this meeting. That's all.
Thank you.
Madam Chair, we have 2 remaining speakers. Our next speaker is Chris Mansueto. I might be saying that wrong. If you could go ahead and unmute yourself, give us your name, spelling, address, and you'll have 3 minutes. Thank you. Can you hear us? Hello? Hello? All right, Madam Chair, we'll go on to the next speaker, Mr. Scott Schuler. Mr. Schuler, go ahead and unmute yourself. Give us your name, spelling, address, and you'll have 3 minutes. Thank you.
Yes, hi. Can you hear me?
Yes, sir.
My name is Scott Schuyler. I spoke at your meeting on Monday. My spelling of my last name is S-C-H-U-Y-L-E-R. My address is 2863 6th Avenue South, St. Petersburg, Florida. I'm calling on behalf of dog groomers. Again, I'm trying to get my dog to see one. And I was reading on the federal level that they deem dog groomers essential. I would like for you guys to keep that in mind when you guys make this decision or are looking for the information. If it's out there federally, states should adopt it, especially if it makes sense. Essentially, if your dogs are not healthy, your family can become sick. Skin care for dogs is one of the most important things, you know, next to them, among the other things, getting them shot records and all that stuff taken care of. Also, dogs' vaccines have the COVID vaccine in it. If your dog's vaccines are up to date, there's no way for your dog to get sick. So then there's no way for your dog to pass it on to you. Thank you very much for your time. I really hope that this information is considered and kept in mind. This is not about money. This is about the health of our animals, which in turn goes along with health of our family. Thank you very much. I hope you guys have a wonderful day.
Okay, thank you.
Madam Chair?
Yes, ma'am.
I understand that our mayor, Frank Hibbard, called in and he inadvertently got knocked off. And so my understanding is he's listening now. Brian, I don't know if you can see that he is called in.
Let's see here. I do not see his name listed unless he's calling in on a phone line. I would need to know what number that is, Commissioner Long.
I'll ask him. Hold on just a minute.
Or if he can raise his hand in the meeting, we can certainly patch. It'd be *9 on his phone.
Did you hear that, Frank?
I think we have him now. Mr. Hibbert, can you hear us?
Yes, I can.
All right.
Can you hear me?
Yes, sir.
Yes.
Very good. Thank you, Commissioner Long. Good morning, Commissioner, Sheriff, City Administrator.
Good morning.
This is Frank Hibbert, Mayor of the City of Clearwater. I wanted to thank you all for having this conversation today. It has been a thoughtful one. No one wants businesses or the beaches to open more than myself, but I appreciate the fact that you are holding off on reopening the beach at this time. I believe it will be soon, but not yet. Our staff has been putting together a robust plan to keep people safe when the beaches and businesses reopen. And I hope that we can just work in cooperation to put these best practices into motion. I want to make certain that we have some level of uniformity, which I think will help our citizens comply. Balanced enforcement is going to be the greatest challenge for all of us, and I believe our citizens are going to be prepared to act responsibly. So I know that we've been in contact with the county administrator, but I just want to start preparing for the point where we feel like we are comfortable and that it is safe enough to allow people to return to the beaches and other activity centers. Thank you all for your time.
Thank you.
Okay, Madam Chair, we continue to have hands go up. We have 5 speakers that are in the list right now. Our next speaker is Gwen Douse, D-O-U-S-E.
Okay. And I would ask again, if you could keep your comments brief, especially if it's been talked about before.
Yeah, I've cut down on my comments. And I want to thank all of you for your very serious and careful assessment of everything that's going on to keep us safe. I live in a condominium on Clearwater Beach, and reopening condominiums, while we all would love to be swimming and walking on beaches, does put us at a much higher risk of getting this dangerous virus, which we haven't talked about at the danger level, which is easily transferable and potentially deadly, and for which, unfortunately, we don't have a vaccine yet. Why do we want to take this risk? And speaking from experience, I can say that condominium pools are close-quartered venues, and prior to the closing of them in March, it had been shown to encourage groups of people to be in close proximity, despite the strong guidelines that our condominium had placed. In addition, common areas around the pool are not continuously wiped down. It's just not practical, which poses another health threat in this common area. These pools are generally located next to condominium buildings, which provides another opportunity for spread, as people who have congregated are now entering the buildings. And because of the lack of testing, we don't know who has the virus or who doesn't. There will be plenty of time for pool swims when this health crisis is under control. Unfortunately, now is not the time. A few impatient voices should not preempt common sense. And again, I thank each and every one of you for all your help today.
Thank you.
Madam Chair, our next speaker is Tiffany McNeil Beach. Ms. Beach, if you can go ahead and unmute yourself, give us your name, spell your name, give us your address, and you'll have 3 minutes. Thank you.
Hi, my name's Tiffany Beach. I live 11 Baymont Street on Clearwater Beach. We have a huge pool deck. It's massive size. Our condominium was doing a great job policing things and limiting and social distancing. It would be really nice to be able to just walk out there and see the sunset, enjoy the beautiful rays of Florida. We all want to be safe. We all want to be secure. And we all want the best for our future. So just thank you for all you're doing.
Thank you.
Madam Chair, we have 3 remaining speakers coming over the phone. They do not have their names listed, so we'll start with the last 4 digits, 5494. If you can go ahead and give us your name, address, and you'll have 3 minutes. Thank you.
That looks like Mayor Hibbard's number.
Oh, that was him. I'm sorry. All right, let me go ahead and move on to